Welcome to this special interview from the Australian National University's College of Asia and the Pacific in Canberra. My name is Nicholas Farrelly and I'm a researcher here who works on politics in mainland Southeast Asia, especially in Myanmar. In today's vodcast and podcast interview, I'm joined by Dr Khin Nyein, who is in Canberra to present recent research conducted by the humanitarian and medical organisation Médecins Sans Frontières, Doctors Without Borders. Their report is titled Lives in the Balance, and it focuses on the difficulties of providing treatment to HIV and tuberculosis patients inside Myanmar. Dr Khin Nyein, thank you very much for joining us today and welcome to Canberra.
Thank you for having me here.
It's our very great pleasure, and I'd like to start with a question about the day-to-day life for the doctors who work with Doctors Without Borders inside Myanmar. For those of us who have no exposure to such issues, could you just give us a bit of a sense of what the day-to-day work looks like for those doctors?
Yeah, okay. I have been working as a medical coordinator in the MSF Holland in Myanmar. So I'm not working as the clinician, but I can share the daily life of my colleagues who are working in the clinics, MSF clinics. Yeah. As the medical doctors, the clinicians, their days are full of patients, doing the consultation and the management of the patients. But especially nowadays, it's become really challenging for the medical doctors in the clinics, because as we have stated in the report, the HIV, because we are focusing on the HIV treatment in the clinics, as the gap for ARV treatment is huge in the country, our clinics are overwhelmed with the number of patients, number of people living with HIV and AIDS who are in need of HIV treatment, we call ART, every day. But as the organization, we are also reaching to our limits, so we cannot absorb all the patients who are presenting to the clinic as other HIV clinics run by other actors. So this situation pushed us, our doctors, to make the choices which is impossible and unacceptable. We have to select the patients who are sickest among all the patients who presented to our clinic, because we have the capacity limits in the clinics. So the challenge is that the doctors, in our clinics, have to select who we will treat and who we will not treat. So it is very difficult to say no to the patient who are in need of HIV treatment. Although they really do not want to do that, they have to do that on daily basics. We have to do that on daily basics.
How many HIV patients are there requiring treatment inside Myanmar today?
Okay, the UNAIDS estimated that there are 120,000 patients who are in need of ARV, because the WHO just recommended in 2010 that all the patients who have CD4 less than 350 are eligible to get the treatment. The CD4 is the marker of the immune system in the body. So when HIV attacks the body, it attacks to the immune system, specifically to those CD4 cells. So when the CD4 cells reduce, the immunity of the person goes down and down. So the body at one point is exposed, open to the other infections. We call that opportunistic infection. So those attack to the body and make the patient sick.
In your report, there's a somewhat astonishing figure of the number of HIV-infected people in Myanmar who succumb to their illnesses because they don't get treatment in time. It was something like 15,000 or 20,000 per year. Yes. It strikes me as an outsider that that's a quite remarkable number. That's a huge loss for the country.
It is. It is true. Yeah, that's why we cannot wait so long. We have to treat. We have to provide the treatment now. That's why we have come up with this report, to get the attention of the international community to provide the money for the treatment for the people with HIV and also with TB in the country. Yeah.
And so Doctors Without Borders has been working inside Myanmar since, as I understand it, 1992, and you've built up a very large program. Can you give all of those out there listening and watching this interview some sense of the scale of the work that you do?
Okay, we have started the program since 1992-1993 in Myanmar, and currently we are working on the HIV prevention, focusing on the high-risk group and the care and treatment, and tuberculosis, including the multi-drug resistant tuberculosis program together with the national TB program, and malaria control program, and reproductive health, primary health care, and maternal and child health with some part of the nutrition. So the scope is quite large, and we are working now in 5 different states and regions in the country, and we have more than 1,200 staff, including the medical, paramedical, the logistics staff, other supporting staff like the admin, finance, and so on.
So with that enormous operation spreading to many different parts of the country, is it hard to keep it all integrated as the medical coordinator for the operations of Doctors Without Borders within the country? How do you manage to keep that all working in the same direction?
Okay, as the mission is really big, it is quite challenging for us, but we try our best to provide the efficient and quality medical care to all those programs, which is, yes, true, quite a challenge. But we also have different advisors in the, let's say, in the coordination team. We have the advisors for the primary health care, for HIV, and for the epidemiology and the data managing, monitoring and evaluation, the lab advisors. So we have a lot of staff who are doing the monitoring, evaluation, supporting, and the quality control of the program. Yeah, it is quite a challenge, but we are trying our best.
And do you find the frustrations are ever overwhelming, that it ever becomes too difficult?
It is quite difficult, yeah, it is quite difficult, but not to the extent that we cannot manage. But that's why I have mentioned that we are reaching to our management capacity limit, That's why we cannot absorb every patient, We cannot cover all. That's why I've mentioned that,
No, I think for those of us outside the country, it's a very sobering assessment of a difficult situation, and a situation that is far beyond the experiences, I expect, of many of those who are watching or listening to this interview. Before we wrap up, and to take us in a slightly more positive direction, I'm wondering if you could speak to what you imagine would be the best case scenario. So if things were to get that much better when it comes to the health prospects for the people of Myanmar, what would that actually look like?
Okay. The best scenario will be all the people in Myanmar getting the access to the quality health care in whatever means. Everybody access to the treatment they need. Yeah.
And how far do you think we are away from that sort of scenario? Is this something that might happen in 20 years, 30 years, 5 years? Do you dare to dream?
It is a good question, and for me personally, I hope for the best. I want to see this happen this year, even. But I don't know. I cannot imagine when it will be the case, honestly. But I'm sure that everybody is working together to reach to that. Including us, including all the medical doctors, all the medical persons, all the people managing the medical activities in the country, national, international, everybody. I think we are moving towards that.
Oh, it's a wonderful prospect, a tantalising one as well. On that note, we will have to conclude our interview for today. Dr. Khin Nyein, it has been a tremendous pleasure, a great honour to have you visit us here at the Australian National University, and we wish you all the very best with your important work. Thank you.
Thank you so much.